Do I need IVF? For some, the answer to this question is simple. If there is no way of essentially getting the egg and sperm to meet due to tubal blockage, the answer is black and white. IVF it is. IVF originated 40 plus years ago for the very same reason. For many others, the answer may seem very grey, as they may suffer from a huge range of reasons, ranging from wanting to have a pregnancy happen sooner, to begin a family in a same-sex gender, or quite unexplained infertility. In vitro fertilization implies the fertilization happening in the lab as opposed to in nature within the body. IVF has been responsible for the birth of well over 100,000 babies in Australia and over 10 million worldwide. Australia's first and world's third IVF baby, Candice Reid, celebrated her 40th birthday this month in June. Candice was conceived at the Royal Women's Hospital, which I'm proud to be part of the reproductive services team. In its early days, all women treated with IVF had blocked tubes, and the chance of success was less than 2% per cycle. Nowadays, IVF is used to help conception happen sooner in just about any reason. If natural conception is not an option or not getting the results you want, then IVF is the most successful form of fertility treatment we have to offer. IVF makes perfect sense and logic in many scenarios, like male factor, embryo testing to avoid dangerous genetic conditions or miscarriages, or in egg freezing. But how about in unexplained infertility? We may cope better when there is an identifiable cause and have an explanation for the problem. Unexplained infertility doesn't mean end of the line or no treatment available to improve your chances. It is sometimes in the process of making that things could have gone wrong. It could happen during fertilization or sometimes more subtle that can only be detected in the lab. There are a lot of maybes in unknown factor, which in IVF we can have the ability to detect and in most cases rectify them. You may want to make plans for one child or keep your options open for more. Some strongly believe that it happened naturally the first time and IVF is not necessary for them later. But I see the struggle women and couples go through coming in with secondary infertility and wanting to have another child. Having one child doesn't make the pain or struggle any easier or less. Some carry the guilt of leaving it too late to start a family, so they can't have the family they dreamed of. Important fact here is most likely the age of both partners would be contributing to the delay in conception, and IVF may improve their chances. Although with age-related cases, the longer you leave it, even IVF success can be minimized. My job is to assess your fertility standing, organize appropriate investigations and give you pertinent facts, help you understand your options and your chances of success with each treatment option. I will help you evaluate every option, chance of success and shortest distance to your pregnancy goal, so you will always be able to make an informed decision. My role is to help you reach your goal, to have a baby in your arms, regardless of how you get there or how long it might take. I'm here to help tailor the best option most suited for you and your partner, and support you both throughout that fertility journey. IVF science has hugely improved from less than 2% back then with little Candice Reid embryo to 50% in some cases. The technology has changed, but the human instinct of wanting a child to love hasn't. We are your best support team to help you get there.